Regular exercise is one of the cornerstones for treatment in people with diabetes. It not only lowers blood sugars, but also lowers LDL cholesterol and triglycerides in people with diabetes. And these are very high risk factors for heart disease in people with diabetes. Apart from that, regular exercise also maintains circulation across our body. Regular exercise also would improve our insulin sensitivity in our body. Regular exercise will also make sure that our muscles develop very well, and an entity called sarcopenia, where our muscles are replaced by fat, it doesn't happen in people with diabetes. So regular exercise has a lot of benefit in people with diabetes. I think how much is there is no upper limit to exercise, but it all depends upon what a person can do. A minimum of 5,000 steps is what we would recommend for people with diabetes. Minimum of 150 minutes of aerobic activities which you can spread within 5 days in a week, and at least 2 sessions of some kind of resistance training is what we would recommend for people with diabetes. The more you do, better for you, but it's extremely important that we do it consistently, and you will get benefits over a period of time. Now, like we tailor medications, we tailor lifestyle, we tailor all our food for patients, similarly exercise has also got to be tailored for patients. Every kind of exercise is good, right from walking to jogging to any other aerobic activities to dancing, Bollywood dancing. Everything is good. Playing any kind of racket sports is good for patients with diabetes. But it's important to realize that we need to tailor exercises. So if a patient has some amount of retinal changes, I wouldn't tell him to lift weights or where there's an increase in Valsalva's maneuver. If suppose there is a patient who has poor sensitivity of the foot, I wouldn't tell him to skip or run. I would tell him to swim. If there's a patient with severe back pain and probably some kind of lumbar issues in the spine, I wouldn't tell him to walk or jog or any other kind. So any other kind of exercise, it would be preferable to swim. So again, exercise needs to be tailored, and most importantly, household chores are also considered as a form of exercise. It's very important that if one is seated, one needs to exercise when one is seated also. So if 45 minutes to an hour has occurred that one is seated at one position, some amount of passive activity, get up and walk, is extremely crucial for the body to develop. One is to hydrate oneself, drink a lot of fluids prior to exercise. Check blood sugars before and after exercises. Sometimes sugars can also go up after an exercise. Also reduce your dose of insulin or some other drugs if you're going to consistently do some exercise. Most importantly, wear proper good shoes. Tight fitting clothes should not be worn. Your shoes should have a wider toe box so that the impact on our forefoot is lesser. Apart from these precautions, is also very, very important to discuss when you are going to embark on an exercise regimen with your healthcare professional or doctor, because it has to be slowly phased up. So you need to have a slow warming period followed by a phase of activity and a cooling down period. So people with a cardiac problem, underlying retinal problem, underlying foot problems should always kind of decide on the type of exercise in consultation with their healthcare professional or doctor. That's extremely important.